So we've all grown up in the era where we've been told if you get headaches, it means you have to identify your triggers and avoid them. Sounds reasonable since they're clearly related. The problem is that the human brain is a machine that functions with one main purpose, which is to explain things even when there is no explanation. That is the way we're wired. So if you've been told that something is true, and then it happens once, you say, aha, I told you so. And then the 100 other times that it happens and that isn't true, you say, well, there's some other explanation, it doesn't count. But as long as it's ever true, we are ready to believe that it's a fact. And that is why we have science, is to try to unpack that. So if you ask people, what are your headache triggers, in a survey of over 1,000 people, most of them say the same things, which is stress is the most common trigger, and then there's hormones and not eating and weather and sometimes certain loud noises or perfumes. Thank God sex is almost never the problem. And then we have a launching point for doing actual experimental studies. Well, if those are true, we'd like to understand how is it that stress precipitates migraine? How is it that weather fronts do that? Well, let's look at that. So on the case of stress, that's a little bit complicated because first you have to define what it means. Is stress how you feel? Is it what happens to you? Is it both? Is it neither? Do you have some way of measuring it? We need an objective measure for defining stress. And some people have done that. So here's one approach, which is to ask people to rate their stress every day along with other measures and then look at the correlation of stress with headache days. So this is all this information that's been indexed to a day with headache. They've been asked about sensitivity to their environment, general achiness, general fatigue, cognitive functioning, positive and negative affect, and then was this a day where you worked harder than normal, and was this a day when you had extraordinary stressors? And when you line all those up to predict headache, this study said there is absolutely no relationship between having a stressful day or encountering major stressors and having a headache. The only things that did show up is that about 36 hours prior to a headache, people tended to notice they had a little trouble thinking and that they were feeling a little down. And feeling a little more tired. So those ideas that there is a prodromal phase when people are functioning differently and then experience headache is apparently a much better way of explaining the relationship between what's outside you and what happens in your head than things cause headache. You're reacting differently to your environment and then a headache occurs. That's because of headache, not what things do to cause headache. Here's an even more precise study where a cohort of patients who said, stress is clearly my most powerful trigger. So what they did was to measure every day perceived stress and cortisol levels, morning and evening, and also autonomic instability based on heart rate variability to look for evidence of stress response in the body. And once again, there was absolutely no evidence here that there was any physiological stress leading to headache, even in people who believe that stress was their trigger. So they feel different about what's going on around them does not mean that stress is causing headache to occur. On the contrary, it means it's a marker for headache onset. So this idea that in this phase of hours to days before the onset of pain, if you're tired and craving weird foods and feeling irritable and foggy-headed, that's a symptom of incipient headache, not a cause. So if you learn to identify that phase, you can say, I'm probably in first gear of migraine. That is actually an extremely useful tool. And when people are given this information, they become incredibly accurate. 95% accurate in predicting the onset of migraine. That is empowering people to manage their headaches as opposed to telling them to live in a black box where they have to avoid all these things that supposedly cause their headaches. So I think it's a useful concept. So stress and headache. Headaches are stressful, no question about it, but when we look for causality even when there is one, even when there isn't one, I think it's simply put, Headaches are a far more common cause of stress than stress has ever been a cause of headache. That's worth thinking about.